We're bringing on a whole new class of intern residents. You see those eager faces, you see, a lot of conviction, a lot of motivation. Mountain Area Health Education Center was founded over 50 years ago really to decentralize where health education was occurring.
This is a big deal. You've made it. You've made it this far anyway, right?
Goal is we want to train more primary care doctors, and we want them to stay in our region, and we want to provide patient care services. You can't train physicians without treating patients.
This program really is the future for rural medicine.
The consequence of losing teaching health centers, more people without primary health care. The need is really tremendous.
There's a mismatch between the workforce and the health needs that we have.
If we truly want a workforce that's prepared to serve where there is the greatest need, we need to train them in those environments.
The story behind Teaching Health Center is that we're bringing training to the community. Mayheck Hendersonville was one of the first Teaching Health Center programs, and it really is a shining star among the Teaching Health Center programs.
A Teaching Health Center is a residency program that's embedded in a community health center or a federally qualified health center. Rural parts of America continue to experience significant challenges. If we're not training doctors to work in those areas, the disparity in the care that's received and the outcomes will continue to widen.
In partnership with the hospital, Mayheck is the academic institution, and Blue Ridge Health, a community health center, our Hendersonville Family Medicine residency program really has a curriculum that is designed to train people for less resource settings.
Prior to the Teaching Health Center program, it was clear that there were problems with access to care. The Teaching Health Center program was started by Congress in 2010, and what that program does is provide grants to federally qualified health centers to be able to create their own training programs and train dentists and physicians in these settings where we need them.
If you've got a predicted physician shortage, every little bit is going to make a difference. Western North Carolina is a hotbed for retirement. We are growing, and we're growing disproportionately in that age group. We must have as many physicians as we can get. It's not just theoretical that training people in rural areas is important.
Physicians who train in rural areas are 2 to 5 times more likely to stay in those settings.
We've more than quadrupled our providers in the past 10 years, and this Teaching Health Center program was instrumental in this. We're able to retain physicians to go out into rural areas that prior had real trouble keeping physicians.
Western North Carolina has been tremendously shaped by the training of teaching health centers. Right now, over a third of the family physicians practicing primary care in Western North Carolina have been trained at one of our teaching health centers.
The retention rate for this program is really incredible. I think for the past few years, most of the residents training with us have stayed either with Blue Ridge Health specifically, or at least in the area serving rural North Carolina. I think the reason is because the training is so strong, both in the medical knowledge that you learn, but also in the example that it shows of how practicing can be really rewarding in this setting.
If we can keep people healthy, we are keeping people out of hospitals. We are going to save our health system dollars, and we're going to save morbidity for our patients. We know that we are part of the safety net of Western North Carolina, and people really take that seriously. We're providing a tremendous service to the communities where these teaching health services exist.
Last year, the Teaching Health Center program funded over 1,000 residents training in more than 80 community-based settings that cared for close to 800,000 unique patients in more than 1.2 million patient encounters.
The Henderson Family Medicine program had a huge impact on my training, providing me with the tools and resources to be successful in a rural area.
Janice.
We have patients in these remote areas who need physicians with great rural training. We have new patient paperwork that is piled up. Providers are needed in this area.
We're pretty well
country people. I don't want to have to go to Gainesville, Chattanooga, Asheville. I'm 88 years old. I can't imagine having to go out there just for a doctor's appointment. I don't even perish the thought. No. I don't even want to think about it. Just so glad that Dr. Bish is here with us.
Amen. Our goal is really to make sure that we eliminate health professional shortage areas in Western North Carolina.
This program is the answer to our needs. Without it, I don't know where Western North Carolina would be.
MAHEC and Blue Ridge Health and this partnership are one example of many across the nation. Prior to the Teaching Health Center program, about 69 federally qualified health centers were engaged in training. Just this past year, over 300 federally qualified health centers are engaged in training. In 2023, $175 million was spent on the Teaching Health Center program, compared to the $18 billion on Medicare graduate medical education financing. What the Teaching Health Center program is doing is clearly being accountable for taxpayer dollars and helping ensure high quality access to care in the communities where we're training physicians and beyond. Investing in the Teaching Health Center programs allows you to care about retaining the workforce in your communities. We want to see teaching health centers in every single state. That is improving access to care. And with increased sustained funding, has the potential to make a healthier America.